Today we are going to touch on breathing, anterior pelvic tilt, and low back pain. Okay, most of the time why people has low back pain is because their pelvic anterior tilting forward in this direction. So when your pelvic is anterior tilted in a forward position, in order to prevent you from falling over, your glutes that's attached from here to here is going to be contracted in order to pull you backwards, and your calf muscles is also going to pull you backwards so that you don't fall forward in an anterior pelvic tilt position. And when you are in an anterior pelvic tilt position, your spine would basically curve backwards. Okay, it would curve backwards again in order to prevent you from falling over. And when you're in this position and your spine, lumbar spine curve backwards, basically your muscles in the back, such as erector spinae or QL, they will be in a hypercontracted state. Okay, so you either have a hypercontracted state of the back muscles here, or the glutes pushing you, trying to push you backwards, or you might have a compression in the front where there's like the psoas muscles that attach to the lumbar vertebrae coming to the pelvic floor, and if they are tight, or you have tight quadriceps muscles, then it's going to pull you forward. Okay, and when you're in this position, your thoracic rib cage would flare up. Okay, so if you're in the anterior pelvic tilt, this would flare up. Otherwise, you will just fall over. Okay, when you're in this position, your thoracic diaphragm will be angled at more like a 45 degrees, and your pelvic floor will be also angled in this direction. Okay, so instead of your diaphragm breathing in and out, going down in this manner, you are now, diaphragm is here, pelvic floor is here. It's in a way it's more stuck, and rather than pushing the abdominal organs downward like this, you are now pushing your guts into forward position. And when you push your guts into, when you breathe and push the stuff into forward, this is how you breathe. You will have a lack of expansion in the posterior thoracic rib cage. So basically you are stuck in this posture. Okay, so what we want to expand the posterior rib cage so that your pelvic can posterior tilt, and it comes in neutral position. Here you can see this is the thoracic diaphragm, and this is the pelvic floor, so everything is flowing nicely. And if you have an anterior pelvic tilt forward due to tight psoas muscles or quadriceps, or the erector spinae, QL, or glutes, that's causing this position, your diaphragm would be stuck in this position, and your pelvic floor will be stuck here. And when you breathe in and out, the abdominal contents will be pushed outwards rather than going down and upwards this way. And you also can see there is a lack of expansion in the posterior rib cage here. So what we want to do is we want to use our hamstring here to posterior tilt the pelvis, and to using the breath to breathe into this, expand this area.
so that you can go back into a neutral position.
And when you breathe in, your pelvic basically opens out in an out flare. Okay, the reason is when you breathe in, your pelvic open out, so all the abdominal organs has a place to fall. Okay, and when you breathe out, your pelvic will go into an in flare, so meaning it comes inwards. So your pelvic floor will comes upward. Okay, breathing in, opening, all the organs drop down, and the pelvic floor drop down. And when you breathe out, the pelvic floor would go up to push the organs upwards. So just to emphasize, let's say the bend is your pelvic floor. You can imagine that if I was breathing in, opening, I would slack the pelvic floor, I will slack the rib band, and if I do this, there will be tension on the rib band. So to correct the pelvic tilt, what we want to use our hamstring muscles. We attach to the tuberosity of the ilium, and we are going to engage our hamstring to tuck our pelvis under. Okay, so from the anterior pelvic tilt, if we use the hamstring to engage, we can tuck the pelvic under, and when we tuck the pelvic under, our rib cage will also come back into a neutral. Okay, so this is anterior pelvic tilt, where the rib cage are flaring upwards, and when we tuck under, everything can sit in a neutral position, and then you can have this neutral pelvic diaphragm. So when we breathe in, notice when I breathe in, my ribs are expanding, and when I breathe out, my lower part of the ribs goes down and in. It does an internal rotation. So breathing in, there's an external rotation of the rib cage, and breathing out, there's an internal rotation of the rib cage going down, under, and in. It's like a corset where it brings down the rib cage. And when we are in this flare-up position, the diaphragm is stuck here. It can't move much. So in order to assist our diaphragm to exhale, inhale to come down, or exhale to go upwards, we want to emphasize on pulling our rib cage down and in. So when our rib cage in the lower part comes down and in, then our diaphragm can dome upwards and downwards in the better motion. And when we can do a better exhalation by pulling our ribs down, our pelvic will eventually automatically posterior tilt or go back into the neutral position.
Over here you can see the diaphragm. Okay, so when the diaphragm inhale, it pushes down the abdominal organs. So all these organs, you have massage going on, and this is the pelvic floor. And if your diaphragm and pelvic floor are not in sync, then all your abdominal organs would somehow be affected. Their motility would not be as effective as they can. And how we are going to get the diaphragm and pelvic floor in sync is we are going to use our external obliques, internal and transverse abdominis here. As you can see, they're attached to the ribs, lower ribs area, and we are going to engage this core, or like a corset. We are going to pull our ribs down and into an internal rotation. And by pulling our ribs down, then that allows our diaphragm to go into a dome shape, going upwards and downwards.
So during a normal inhalation position, this is how the body sort of orientates itself. Okay, so when we breathe in and when we breathe out, so if I were to exaggerate the movement, breathing in and breathing out, okay, when we breathe out, we are more in this direction, and we breathe in is more in this direction. Okay, so we want to use the exhalation to bring the rib cage backwards and tilt down under. So the exercise that we can do so in this position, I'm going to engage my hamstring to posterior tilt, under tuck my pelvis. Okay, so the first thing I'm going to do, I'm going to pull my heel towards my bum to engage my hamstring, and then I'm just going to lift my pelvic up a little and tuck it. Okay, so it's just about like nearly 1 finger length. If you do this, then there's too much, or using more of a glutes rather than your hamstring. So it's just a posterior tuck. It's not just lifting up, it's a posterior tucking of the pelvis. And then you all are just going to do this a few times, getting used to the movement of posterior tucking, engaging more of the hamstring rather than using too much of your abs. You are going to incorporate the breathing, where when you breathe in, you're going to breathe into the upper chest, and when you breathe out, you're going to bring down the lower ribs down and inwards. Okay. And then you can direct your hands to 45 degrees to put more air into the upper and middle part of the chest area. When I breathe out, not only I bring my ribs down and in, I'm engaging my external, internal, and transverse abdominis, oblique muscles to like a corset to bring everything down and in, rather than keeping my 6 abs soft. And at the same time, always push the heel towards the bum area to posterior tuck the pelvis. Okay. The whole purpose of the exercise is to bring you from an anterior pelvic tilt and with your rib cage flaring to posterior tuck, and using the exhalation to bring yourself back into a neutral position where the pelvic diaphragm and the thoracic diaphragm goes in sync with each other.